Monday morning, a juvenile committed suicide by jumping off the 135-foot Piscataqua River Bridge. Many believe suicide barriers could have prevented this and other tragedies.
My son leaped over in a matter of seconds.
Stephanie Cossette's son Brandon is one of 12 people who have committed suicide by jumping from Maine's iconic Penobscot Narrows Bridge. The 25-year-old was struggling with a mental health disorder. She believes a suicide barrier could have saved his life.
Unless you have the barriers up, the suicides will continue.
There were 14 suicides on Memorial Bridge in Augusta before suicide barriers were installed, and none since. Steve Norman, whose daughter Siri jumped from the Penobscot Narrows Bridge, told a legislative committee suicide is often a moment of crisis that passes. A suicide barrier would allow people that second chance. His testimony led to newly installed barriers on Penobscot Narrows Bridge. He told us today he fully supports barriers on all tall bridges, including those connecting Kittery and Portsmouth. Seacoast Mental Health Center was instrumental in getting new suicide prevention signs on the Piscataqua River Bridge, but says barriers are the ultimate goal.
So we were looking at the Golden Gate Bridge in San Francisco as a model for this. They have done signages, barriers, phones, and their suicides have dramatically decreased over the past several years.
3 years ago, a Portsmouth officer talked someone down from this bridge. Police say barriers would be a better deterrent.
If we had the suicide barriers, obviously they'd work as a prevention tool that hopefully may not stop all of them, but at least slow the attempts of people trying to get over the bridge.
Certainly a good idea. You know, the state's juggling a lot in terms of, being able to fund that.
Those suicide prevention signs are expected to go up next week on the Piscataqua River Bridge. A good first step, but many believe barriers would be even better. In Kittery, Brad Rogers, CBS 13 News.